7 essential vitamins for hair to reverse hair loss. Hair is one of the body's physical aspects that we care most about and impacts how we see ourselves and how others see us, allowing us to define a style and even complement our personality. However, many people face issues with their hair that go beyond a rebellious mane, undefined curls, or dull and lifeless straight hair. We're talking about alopecia, or hair loss, a condition that affects millions of people and plays a fundamental role in how we feel. In today's video, we'll present 7 essential vitamins for hair to reverse its loss so that you can improve the health of your hair and regain a full mane. Before we delve deeper, don't forget to subscribe to our channel and turn on notifications to stay updated on our releases. Did you know that most people have between 100,000 and 150,000 hairs on their head? When you comb your hair and see many strands on the brush or in your hands, don't be alarmed. This is normal because we have many hairs on our head. It's common to lose about 100 strands every day, and if your hair is long, it may seem like you're losing more, but it's only about 100 strands. Now, you might be wondering, how can I lose so much hair and still have a full head? The answer lies in the protein called keratin, which forms our hair. Inside the skin of our scalp, there are small hair factories called hair follicles that produce keratin cells. These cells come together to form hair, which grows about 15 centimeters per year. Hair goes through 3 growth phases. First, it actively grows for 2 to 8 years, then it goes through a transition phase of 2 to 3 weeks, and finally enters a resting phase of 2 to 3 months before it starts to fall out. But don't worry, new hair is always growing to replace the ones that fall out. Sometimes we may lose hair faster due to various reasons such as health problems or external factors. This is known as alopecia and can be treated depending on the cause. 10 causes of hair loss. Number 1. Hormones. Hormonal changes can affect hair growth, which commonly occurs with thyroid disorders where the underproduction or overproduction of thyroid hormones leads to hair loss. Having elevated levels of androgens also stimulates hair loss. Number 2. Genetics. Genes can also influence the development of baldness. Those with a family history of baldness have a higher risk of developing baldness over time. Number 3. Stress and illnesses. Certain individual conditions such as stress levels, pregnancy, childbirth, and some illnesses like fungal infections can lead to hair loss. In these instances, it's possible to reverse the effect with disease treatment, learning to reduce stress, or promoting increased vitamin intake during pregnancy and childbirth. Number 4. Medications. Some types of medications can induce hair loss either due to their chemical components or the action they generate in the body by blocking or inhibiting certain processes. Among the medications most associated with hair loss are chemotherapy, anticoagulants, blood pressure medications such as beta-adrenergic blockers, and birth control pills. Number 5. Injuries and exposure to X-rays. Certain skin injuries can cause hair loss without affecting the scalp. This usually occurs with burns, scratches, and wounds. Hair regenerates once the injury heals, unless scars form in the affected areas because hair doesn't grow back in scarred areas. Frequent exposure to X-rays can also induce temporary hair loss. Number 6. Autoimmune diseases. In autoimmune diseases, the immune system attacks the body itself by mistake. This can cause a variety of reactions and may manifest in different ways in the body. One type of autoimmune disease is alopecia areata, where the immune system attacks hair follicles, causing hair loss. Once the immune system returns to normal, hair grows back, but it may take time and be of a lighter shade until pigmentation and thickness recover. Number 7. Cosmetic procedures. Some cosmetic procedures for hair can weaken the hair shaft and promote its breakage or complete loss. This typically occurs from using overly harsh shampoos, hair dyes, straightening or perming products. Similarly, the use of thermal tools like flat irons or curling wands can cause scalp burns and damage the hair shafts, leading to breakage. Additionally, some styling techniques like very tight braids, tightly pulled buns, or sleeping with wet hair weaken the strands and can cause breakage or loss. In most cases, the hair regrows and recovers when the harmful cosmetic treatment is discontinued. Number 8. Medical conditions. Some health conditions also influence hair loss. The most common ones are thyroid disorders, diabetes, anemia, lupus, and eating disorders. In these cases, treating the underlying cause is necessary to recover hair. Number 9. Diet. A poor diet or one based on processed foods can lead to deficiencies in vitamins and proteins. Proteins are crucial for maintaining the health of the hair follicle and hair shaft since keratin, a type of protein, forms the hair. Similarly, calorie restriction can reduce metabolism, cellular work processes, and affect some non-essential bodily functions like hair production. Number 10. Vitamin deficiencies. There are micronutrients that are key in hair growth and care. If you have a deficiency in these, your hair may weaken and fall out. Among the most necessary micronutrients are vitamins A, B, C, D, E, and minerals iron and zinc. Which vitamin deficiency causes hair loss? Many vitamins intervene in the hair growth and maintenance process because they promote keratin production, cell health, and support hair elasticity and strength. Therefore, having a vitamin deficiency can cause hair loss. Among the vitamins whose deficiency or low levels can lead to alopecia, B-complex vitamins are necessary because they promote blood flow and red blood cell formation, which are necessary for cell production and hair follicle strengthening. Iron is an essential mineral for hemoglobin formation and oxygen transport to the hair follicle. Its deficiency leads to hair loss. Vitamin D plays a role in DNA synthesis processes and mineral absorption. Its deficiency has been shown to cause alopecia. Vitamin E is a valuable antioxidant. Its deficiency can cause free radicals to damage hair follicle cells, leading to their death and hair loss. Omega-3 fatty acids are an important part of cell membranes and cannot be produced by the body, so they must be obtained through diet. Their deficiency causes cell damage, promotes inflammation, and affects hair health. Zinc is an essential mineral for cellular health. Its deficiency has been associated with alopecia. 7 essential vitamins for hair and reversing its loss to keep your hair healthy. You must incorporate into your diet some micronutrients that are involved in the process of cell development and hair follicle care. Let's see. Number 1. Vitamin D. Vitamin D is crucial for maintaining our hair's health. It helps absorb and fix important minerals in our body. This not only strengthens our bones and keeps our skin healthy, but also helps create new openings in the skin of the scalp, called hair follicles, where hair grows. If you don't have enough vitamin D, you may start losing hair. Low levels of vitamin D are linked to some types of hair loss. You can easily get vitamin D by spending some time in the sun, but as we often protect ourselves from the sun, we may not have enough vitamin D, especially in colder or cloudier climates. To take care of your hair, it's a good idea to take vitamin D supplements or eat foods containing this vitamin, such as eggs, fish, mushrooms, dairy products, and fortified cereals. It's also good to get some safe sun exposure to increase your vitamin D levels. Number 2. B-complex vitamins. B-complex vitamins are diverse but necessary for overall health and hair strengthening. Among the most necessary for hair are B12, B7, and B5, known as pantothenic acid. Vitamin B12 is necessary for red blood cell production, energy maintenance, metabolism, blood flow, and hemoglobin. Deficiency of this nutrient can cause anemia, physical weakness, cell damage, and hair loss. Biotin, or vitamin B7, is also associated with hair loss, while supplementation with this vitamin strengthens hair health and reverses hair loss. Vitamin B5, or pantothenic acid, protects the health of the hair shaft by forming a particle around it that acts as a protective layer. This makes the hair more manageable, shiny, and resistant, which is why many hair products contain pantothenic acid as an ingredient. You can get B-complex vitamins from a variety of foods such as leafy greens, legumes, nuts, meats, avocados, and fish. Number 3. Vitamin E. Vitamin E is a powerful antioxidant that protects cells from free radical damage and promotes their regeneration. Maintaining an optimal level of vitamin E in the body is crucial for hair health as it supports scalp circulation, promotes hair growth, and prevents hair loss. You can find vitamin E in foods like almonds, sunflower seeds, spinach, avocado, and olive oil. or you can take vitamin E supplements to ensure an adequate intake. However, be cautious, as excessive levels of vitamin E can also contribute to hair loss. Number 4. Vitamin C. Vitamin C is a vital micronutrient if you want to take care of your hair. This vitamin has antioxidant and anti-inflammatory properties, besides promoting collagen and keratin production, two essential proteins for hair health. Its antioxidant action protects cells from damage caused by free radicals while supporting follicle health. Similarly, its anti-inflammatory action promotes better scalp health by reducing inflammation, improving oxygenation, and promoting growth. Number 5. Vitamin A. Vitamin A, essentially retinol, is a micronutrient necessary for cell and tissue health. It reduces cellular damage, prevents wrinkle formation, and improves hair resilience. Vitamin A stimulates hair growth and enhances the production of natural scalp oils, necessary for protecting and maintaining natural hair hydration. Number 6. Iron. Iron is one of the most essential minerals for health, as it influences hemoglobin production, a protein transporting oxygen to body tissues and organs, as well as myoglobin, which transports oxygen to muscles. Iron deficiency is associated with hair loss, as it decreases oxygenation, limiting bodily functions to those necessary for survival, such as respiration and heartbeats. Iron deficiency leads to weakness, anemia, and, in extreme cases, can result in death. The good news is that you can obtain iron from various foods such as red meats, poultry, eggs, nuts, dark green leafy vegetables, beans, legumes, tofu, and fortified foods. Number 7. Zinc. Zinc is one of the most essential minerals for hair care as it stimulates cell growth, inducing hair follicle growth. Additionally, zinc promotes the production of sebum or natural oils on the scalp, providing protection and hydration to the hair strands. You can get zinc from green leafy vegetables, legumes, pumpkin seeds, red meats, seafood, and fortified cereals. Hair loss is a natural part of the hair growth and shedding process. We typically lose about 100 hair strands daily. However, excessive hair loss may indicate alopecia, caused by various factors from diet to health conditions. Including foods rich in the necessary vitamins for hair health in your diet can help you regain your hair and reverse the loss process. We hope this video has been helpful. If you have anything to add, please share it with us in the comment section. Don't forget to like this video and share the link with your family and friends so they too can benefit from the 7 essential vitamins for hair to reverse its loss. If you're new to our channel, don't forget to subscribe and to keep learning. I'm leaving 2 videos on the end screen that I'm sure you'll enjoy. See you there.